So Katie and I are just going to sort of take it in turns, go through some of the questions that we've received. So, okay, probably the first thing for me to do is ask Katie our first question that came through ahead of today's session, which was from Winkworth Weybridge, and they were asking about when cancer returns. Yeah, I mean there's quite a big
So,
question,
I
really.
mean, that's quite a difficult question to answer broadly because it's quite a broad question. But I suppose the key thing to say is that for most people, cancer doesn't come back, and that's the aim of having your treatment. So the aim of treatment is to firstly remove the cancer and then to give you any extra adjuvant treatments to reduce the risk of that cancer returning. In some cases, unfortunately, it does come back, and that's not called a cancer recurrence. And we can't accurately predict who that will happen to or when. But we would say that it's really important once your treatment is finished to be breast aware and to be aware of your body. And if you were to notice anything that was unusual, that was new, that was persistent change that you can't think of a cause of, then it's really important to get that checked out. So to either get back in touch with your treatment team or to get back in touch with your GP if it's a long time down the line. But the aim of treatment is to reduce that risk as much as we can of the cancer coming back. So I don't know if there's anything else you'd like to add to that, Jane.
I think that, that's like you say, it's for the majority of people, treatment does reduce the risk of the cancer coming back. There is a small number of people who do develop a recurrence, but like Katie says, it's often people find when they've just finished treatment for primary breast cancer that the anxiety and the worry of cancer coming back is really, really, intense and strong and overwhelming. And as in time, that does get better as time goes on. But in terms of symptoms and breast cancer recurrence, like you say, Katie, anything that's new or persistent, not an obvious cause, it's always worth flagging with your team or the GP. So I'm happy to answer any more questions about that if they come through. But yeah, should we go on to the next one, Katie?
Yeah. So Pamela had submitted a question before asking what the significance of progesterone is. And it's never mentioned in pathology results. So I'm assuming she's talking about receptors there. But,
yes. So when breast cancer is tested for hormone receptors, and it will be hormone receptor positive or negative, and that means that these breast cancers can be treated with hormone therapy drugs to lower estrogen levels and block estrogen levels if you're hormone receptor positive, because the cancer feeds off estrogen. So hormone receptor positive breast cancers, they use estrogen to sort of grow and spread, and that sort of pathway has to be blocked or stopped somehow, and that's where the hormone therapies can be used and treated. But some people will be so the two main hormones that they're looking at are estrogen and progesterone that are looked for. Somebody can be positive to estrogen and progesterone, to both of them. They could be positive to one or the other, or they might be negative to both. But if someone has a hormone receptor positive breast cancer, it means they can be treated with hormone therapies to reduce the risk of the cancer coming back. So it has some sort of significance. I thought it was on pathology reports generally, but I'm not. Perhaps Katie, I don't know if you've got any thoughts on that. But I often think
I think it is on pathology reports, isn't it? I think more emphasis tends to be on the estrogen, doesn't it?
Yeah.
But usually, and not in every case, but mostly, if you're progesterone positive, you're also estrogen positive. I think is that. I think that's right. So that's when hormone therapy would be recommended. And if it's negative, if you're estrogen and progesterone negative, then hormone therapy wouldn't be of any use for you. So.
Yeah, exactly. So if we move on to another question that we've had in, and it's on the sort of hormone therapy line. So it's from Pat. Mm-hmm. And Pat has asked about the side effects of the anastrozole that she's taking. She's finding the side effects very tough, especially joint pains and hot flushes. which are really affecting her quality of life. Something we hear a lot about, isn't it, Katie?
Yes, it is. Yeah, we get a lot of calls to the helpline about that, and it is unfortunately really quite a common side effect of the hormone therapy. Depends, Pat, how long you've been on that hormone therapy for. Some people find that initially, when they start taking the tablets, they get quite bad joint pains and hot flushes and other side effects. But after a few weeks and months, sometimes that does get better on its own, as your body becomes more accustomed to it. There are things that you can do to help with that. So things like sometimes with the hot flushes, things like fans, natural fibres, keeping hydrated, looking at your diet and seeing if there's anything that triggers a hot flush. So some people find that actually if they have spicy food, that can make them worse. Caffeine, alcohol sometimes can make them worse as well. And with joint pain, things like exercise can actually be very helpful. Analgesia can sometimes help as well. But it's also, some people would sometimes suggest, and it's worth talking to your doctor, to your treatment team, if you are really struggling with your quality of life, and seeing whether they might suggest stopping the tablets for a little while, to see if they improve, because sometimes they might be absolutely nothing to do with your hormone therapy, and it could be another cause there. But if it does improve, then they can look at maybe switching you to a different tablet, to see, and even if a lot of them have very similar side effect profiles on paper, but people find that they get on better with one tablet rather than another. So it is
Yeah.
worth investigating that, and don't just put up with it, because there are things that can help. Absolutely. And we've got a lot of information on our website about that as well.
Yeah, definitely, definitely. And we've had a few questions coming through live as well, Katie. So I don't know if you want to pick one out for me.
Yeah, so where are we? Charlie has said here, what is the prognosis when you have cancerous lymph nodes in the neck and chest? And she says thinks that's been called locally advanced.
Yeah, yeah. Prognosis is a really difficult thing to discuss because it will be
hard,
very
isn't it?
individual, depending on the person. So we do know that sometimes breast cancers will, either at the time of initial diagnosis or at a later date, spread to the lymph nodes in the chest, sort of in the neck, in the chest, and that is, as Charlie says, described as locally advanced. And there is treatment available. The prognosis really depends, and only someone's oncologist would really have any idea. And even for them, it's difficult because you just don't know how somebody's going to respond to treatment. So if somebody has a really good response to treatment and their cancer's under control, you know, their prognosis is going to be very different to somebody who perhaps doesn't respond to the treatment. So that is a really difficult question to answer, Charlie, and I don't, you know, it's really just almost impossible, I would say. But it's understandable that you'd want to know what that prognosis is, whether it's for yourself or for somebody else. But the best person to speak to would be your treatment team to find out what the treatment is and what, you know, the possible prognosis for you as an individual is.
Yeah. And there are so many more treatments coming through as well, aren't
Yes.
there, Jane? So it's it
Yeah.
is very much dependent on an individual now as well. So it is difficult for us to comment, and your oncologist might find that hard to give it
Yeah.
an exact answer. Well, they will find that difficult to
Yeah,
say.
but they just might have more of an idea based on everything that they know about you
Yeah.
and you know, your situation. So do ask. But yeah, like you say, even for them it can be difficult. So Julie's asked a couple of questions, Katie. She said, I've just worried as I finished letrozole after 5 years. Yes, does cancer return? But a follow-up question is, will my letrozole just stop or will someone see me before?
Yeah, good questions. So letrozole, I suppose it depends a little bit on where you're being treated. But usually you're followed up for a couple of years after your treatment, your active treatment. So that's your surgery and your radiotherapy. So you may, up to 2 years, depending on your age and your circumstances, still see a doctor then. After that, often people are now in open access follow-up, and they don't necessarily see anybody after at the 5 year mark. And it sounds like you're finishing your letrozole after 5 years, and you don't know whether you will see anybody, and you may not, but you would still be under the care of your breast care nurses or your team in some degree, and that's normally as an open access follow-up. So if you have got questions, you can always phone your team and ask them about that. So I think it varies where you are and and how old you are, and well, not how old you are, but on your individual circumstances, really, as to whether you'll see anybody beforehand. But if you've got questions, you can always talk to your treatment team, or you can phone us as well on our helpline, and you can talk to the nurses on our helpline that can talk you through what that means for you.
Often people sort of feel like their hormone therapy is a bit of a safety net and worry about stopping it and worry whether they need to sort of come off it slowly, which you don't need to do. And the other thing to bear in mind is that people usually take hormone therapy like Julie, you are, for 5 years or 10 years if that's necessary. But there's something called a carryover effect. So even though you're stopping it after 5 years, the benefits of taking it for 5 years will continue. They will continue on, and hopefully the only thing you'll notice is if you are having side effects from it that they improve. But yes, it's a good question, and like Katie says, do give the helpline a ring if you've got any other questions about it. Hope that's okay.
Another one on hormone therapy is from Ali, who said she's been on tamoxifen for 9 years. I've had yearly mammograms, but they've never checked my hormone levels or done blood tests. Should these be done?
So the tests on the hormone receptors are done at diagnosis. So I'm sure if you're on tamoxifen, Ali, they would have done that when you were presumably diagnosed 9 years ago. They would have assessed your hormone level status, your estrogen, progesterone receptor status at the time. What blood tests someone has will again vary on their individual situation. There are some blood tests that can look at hormone levels to assess someone's menopausal status, but again aren't done routinely for everybody. So it doesn't. It's like I say. It sounds like your hormone levels, your estrogen receptor levels, would have been done initially at diagnosis, but this will all be on your medical records, and it's something you can ask your GP to go back over just for peace of mind and reassurance. And presumably you'll be stopping tamoxifen at 10 years anyway, so. That's a sort of an opportunity to discuss that as well with the GP. They can contact the specialist team, the breast team, the oncologists at the hospital that you are under, if they need any sort of further information about your individual situation.
Yeah, and I suppose the other thing to say is sometimes people do have their hormone levels checked if they're premenopausal when they start on tamoxifen and they're taking it and they want to switch them to something else. They might see if they've become postmenopausal at that point. But again, it's all very much individual circumstances and your situation. But yeah, you can always talk to your doctor to see whether that, but not everybody has that done at all.
No. Okay, so moving on, Charlie is asking again about HRT. So I went on HRT 5 months before I discovered my cancer. Did the HRT cause it make it worse?
Oh gosh, that's difficult, Charlie, and it's so many people trying to find a cause for what might have, trying to look into what might have caused their breast cancer, and the simple answer is we really don't know, and it's difficult to know what's caused your cancer. But cancer is caused by a number of things combined. So it can be from your environment, it can be from your lifestyle, it can be from the character, just your genetics, all sorts of things together. But we know the biggest risk factors for developing a breast cancer are being female and getting older. And there's nothing that you can do about either of those two things. So it's difficult to know what has caused your breast cancer. Hormones do have some sort of an impact, and they can slightly increase the risk, but 5 months of HRT is unlikely to have caused that in your situation. So yeah, it's really natural to try and find a reason for why you've developed a breast cancer, and I'm afraid we can't really say. But I would say 5 months of HRT is very unlikely that would have been a contributing
Yeah,
factor.
I'd agree with you there, Katie. It's not long, is it? So, yeah, totally agree with that.
And Liz has written in, and she said, let me just read this for a moment. I was triple positive, I presume that means triple receptor positive and node positive, but I couldn't have Herceptin due to my heart failure. What is the chances of recurrence?
Okay, so in a way, this is a bit like the
Similar to
prognosis
the other
question.
Yeah.
It's really sort of almost what it is impossible for us to say based on that. So triple positive, Liz, I imagine you were estrogen, progesterone, and HER2 positive, which is the triple positive, and then the lymph nodes under your arm were affected. So in that situation, somebody would usually have chemotherapy. They would have Herceptin, like you say, trastuzumab. But because of the side effects of Herceptin, because it can affect the heart, that can be one of the side effects. If you've got a pre-existing heart condition, then obviously that does impact on whether you can have these kind of treatments or not. And obviously it sounds as if because you couldn't have it, probably the Herceptin would have caused out the drawbacks of the Herceptin would have outweighed any benefits. So with all treatments, the doctors are trying to make sure that the benefit of it is going to outweigh any drawbacks or side effects of it. But really it is impossible to say what the chances of recurrence are. And again, it's back to the treatment team to see if they can shed any light on that. Again, it might be difficult for them. Excuse me, my voice is going. It might be a bit difficult for them too as well, a bit like the prognosis question, but certainly it's something to discuss with them so you can, have your questions answered if possible, and help you sort of move forward and live life without that sort of permanent fear of recurrence. But like Katie said, monitoring, being breast and body aware. Sorry, Katie, was you going to say something?
No, I was going to say it's a balance, isn't it? It's always a balance about weighing up side effects and benefit. And the fact that you said you were triple positive sounds like that you're ER or estrogen positive as well. So I hope maybe will be on some hormone therapy as well, and that reduces the risk of the cancer coming back as well. So it's your oncologist would really be the only person that may be able to give you a better idea because they'll know more about your cancer and about you. But yeah, it is a difficult question to answer.
Exactly. So we have Tina. So Tina's asked, should I start taking calcium tablets? I'm on tamoxifen now. We'll be going on to letrozole in 2 years. So is it best to start now?
Well, that's an interesting question, isn't it? It's a bit difficult to know, Tina, really. I know often when you start on letrozole, you were given calcium supplements to sort of boost your calcium and because we know that letrozole can reduce your bone density, so it's more of a protection side of things. If you haven't had a bone density scan, it's difficult to know what your bone density scan is, so it might be worth discussing that with your doctor just to check, because they'll need to check what other medications you're on as well to see if any of them interact and what dose you were thinking of taking. We often get questions about supplements, and we would always say go back to your treatment team and ask about that, just to check that they're happy for you to take that, or your pharmacist might be able to tell you as well. Tamoxifen doesn't reduce your bone density, so from that point of view you don't necessarily need it, but if you've had a bone density and they're saying that it could be of benefit, that might be a good idea. Is there anything else that you would add to that, Jane?
Just the other thing to add is if they do recommend that you take calcium, often it's in combination with vitamin D, they can prescribe it, so you can get it on prescription and don't have to pay for them. So that's just another sort of thing to think about. If it is recommended for you, it can be prescribed.
And Davina's written it. I'm on exemestane. Should I have my blood pressure and cholesterol checked at all?
So exemestane we know can cause the level of cholesterol to rise in the blood. although it's not usually enough to require any treatment. It kind of depends on whether you have any other sort of history, Davina, whether you have any other, if you've got any history of an elevated blood pressure, or if you've got any history of sort of cholesterol levels. Often GPs, will start doing these sort of health checks for people's cholesterol, sort of when they get to middle age, really. So it kind of depends on your baseline. So it would be that's one for your GP, because your GP can establish your baseline, and then decide from there whether you need to have anything done on a regular basis.
Monitors, yeah.
Yeah. Okay. So Deb asks, I've had a double mastectomy, 3 cycles of EC, which is chemotherapy, two cycles of DOC, which I imagine is docetaxel, 18 months of tamoxifen, and I've just been told I now have bone mets in the T10 spot in my spine. What are my chances of living a long life? My oncologist isn't great. I'm having a biopsy next Tuesday. I'm only 39 and I have 2 young children I want to see grow up. That's really tough, isn't it?
It does. That sounds like you're having a really tough time of it, and that's really difficult to get your head around all of that as well. So I'm sorry you're going through all of that. Like the other 2 questions that we've had, it's difficult to put timelines on anything. And your treatment team would be the best person to be able to tell you a little bit more if you wanted to have timelines and things like that. But we know more and more people now are living with a secondary breast cancer diagnosis, and there are lots more treatments available, and some people are living for a very long time, aren't they, Jane? But yeah, I think it depends very much on your situation and what that biopsy shows next week and what treatment that they would want to be recommending.
Yeah. And Debs, you mentioned your oncologist isn't great, but I wonder if there's a breast care nurse that you could talk to about all of this as well. And just to mention, we do have dedicated services for younger women with secondary breast cancer. So, I'd really encourage you to give our helpline a ring. We're open today till 4. The number's 0808 800 6000, and we can sort of properly talk all this through with you one-to-one. I think that perhaps would be hopefully a bit more helpful in terms of what we can offer support-wise for you. Like you say, you're only 39, 2 young children, and to have gone through all that treatment, it sounds like you went through all that treatment thinking that obviously you were having treatment for a primary breast cancer. Now you have got this area of bone mets on your spine. But like Katie says, there's lots of treatments. There are women that are living with bone mets, a good quality of life. So it's well worth, like I say, just talking to your team, talk to us, and like I say, we can try and sort of support you. And give you a bit more information one-to-one. I think that would be the ideal.
Absolutely. And we can signpost you as well if you want support for your children and things like that. There's lots of other places that we could signpost you to if you want, because it's can be very difficult trying to find people in a similar situation to you or that understand what you're going through. So please do give our helpline a call, or look at our website and look at the services that we do offer.
Yeah.
Dorothy has asked, I've just finished chemo for stage 2 breast cancer. I was prescribed letrozole, and I'm worried that one of the side effects is weight gain. Having chemo, my weight increased by 2 stone. Can your GP or oncologist prescribe me something for weight loss?
Right, yeah, so weight changes and weight gain can happen, we know, with sort of cancer treatments. And there's a variety of reasons for that. There isn't anything that your GP can prescribe for weight loss, but your GP practice can help you with weight loss sort of advice and support. That might include some GPs can refer people to sort of weight loss clinics, slimming clinics, so you don't have to pay. So you go to sort of a Slimming World or these kind of community weight loss initiatives. So some GPs can recommend that. But it's really hard, and it's really hard to shift weight. But there isn't anything your GP or oncologist that would prescribe for that. I think they would be sort of looking at lifestyle factors, so healthy, well balanced diet, very limited alcohol, physical activity, and yeah, like I say, there's lots of support for weight loss in the community, which are, like I say, things like Slimming World or Slimming Weight Watchers, and the GP practice, or the practice nurses can also help you with weight loss advice.
Yeah. And sometimes they can prescribe exercise as well. So there are some sort of exercise programs, and there's certainly exercise programs from cancer charities that you might be interested in.
Yeah.
And it's about building up gradually, Dorothy. So you may not feel you've just finished your chemotherapy. It's going to take time for you to become active, but it's possible. But just take it slowly, really.
Yeah. We've got information on our website about diet and physical activity, and all the sort of lifestyle factors of moving forward with after a breast cancer diagnosis. And also, Dorothy, you might be interested in our moving forward program, which is for people who have completed their main hospital treatment. And they're trying to move forward with more confidence. And these take place face-to-face in some locations, as well as online. And you can come together with other women who are in a sort of similar situation and have talks from experts, like sort of physical activity or diet, lymphedema, all these kind of things. And that sort of peer support can be really helpful.
Yeah.
I think we've got 1 minute left, haven't we?
I think so.
So
I haven't seen any more questions come through.
No. Do, like I say, call the helpline for any questions you've got. 0808 800 6000. We're here today till 4. You can always drop us an email, nurse@breastcancernow.org. Any final words from you, Katie?
Thank you for asking the questions. I hope they've been helpful, and we will see you again very soon.
Yeah, thank you.
Bye-bye now.